My name is Deepak Sambhara. I'm a retina specialist in Wausau, Wisconsin at the Eye Clinic of Wisconsin, where I serve as a partner and medical director of research. Harmony is the perfect system for me, and what I mean by that is it allows me to take images across campuses at different satellite locations and manage patients across different areas through one centralized system. Harmony is kind of the perfect marriage that lets me compare data from one location to another without sacrificing patient care. Rather than be tied to a computer and a physical device, I'm on the fly all the time, and so every second matters, every moment matters, and Harmony realizes that, Topcon realizes it, and it gives me the chance to still run an efficient clinic while seeing patients. One of the neat things about Harmony is I can have an autofluorescence image open alongside an OCT image that's open, along with the Fundus photo. And having all three of those sometimes gives you the ability to correlate structural changes that you see on OCT with fundoscopic changes that you may not be able to see at the slit lamp. One of the beautiful things about Topcon is that they've invested in artificial intelligence, in automation, and I think it's really gonna take people who live on that nexus, who are willing to take the next steps in automation to better improve how we manage patients. I think the Maestro 2 is really interesting because I think for the first time we now have a device where you're able to get a fundus photo, you're able to get an OCT image, and you're able to get an OCTA image basically in 20 seconds or less. And I think that the capacity and the ability to make decisions based on all three imaging modalities has just expanded our bandwidth. At the end of the day, being able to get a test where you have so much information that's acquired in such a short time is probably the biggest help for our technicians. And I've found that Topcon's always been proactive. They're looking for the next big thing, the next wave for us to be able to optimize patient care, and they're leaning into trends that we see happening real time. And so the fact is that if I have a question, I can call my folks at Topcon and get the answer I'm looking for, and if I can't answer it, they're willing to sit with me and help me find that answer. How are we gonna be able to optimize clinical care outside of the eye, but where the eye might be the initial manifestation of the disease? How are we gonna get primary care doctors, endocrinologists, ophthalmologists all working in unison? These are questions that Topcon's already thinking about. And so when I say being proactive, Topcon's really throwing their hat in the ring and identifying themselves as more than just an eye care company. It's a patient care company.